The pandemic may feel like a distant memory, but is it truly behind us? Stick around, because you'll be surprised by what's still happening with COVID-19 in Singapore. Could we be facing another wave? Let's dive deep into the numbers, expert insights, and what this means for us all. Earlier this year, in May 2024, Singapore saw a spike in COVID-19 cases. Despite the easing of restrictions, the risk of new outbreaks lingers. Here's an alarming fact: 20% of Singapore's population hasn't received a vaccination dose in the last year. This significant group faces waning immunity, as confirmed by the Ministry of Health, MOH. What does this mean for our collective safety? Let us know your thoughts in the comments. An Ipsos study conducted between May 6 and 13 surveyed 2002 Singaporeans and revealed some eye-opening trends. Testing behaviors have significantly changed. Compared to February 2024, the proportion of respondents confirming COVID-19 cases through testing dropped from 33% to 24%. Why do you think fewer people are testing? Is it complacency, cost, or simply pandemic fatigue? Share your views below. Expert Leong Ho Nam sheds light on this decline. He attributes it to Singapore transitioning to treating COVID-19 as endemic. Pandemic fatigue is real, and with treatment no longer fully subsidized since April 2023, reluctance to test has grown. But here's the kicker: reduced testing makes it harder to track the virus and detect new variants. Imagine how this could impact our healthcare system and the emergence of resistant strains. What do you think could be done to encourage more testing? Here's another startling insight: many Singaporeans with mild symptoms or suspicions of COVID-19 are skipping tests altogether. Did you know that even mild or asymptomatic cases can lead to complications like long COVID? And these cases are just as contagious. If you've ever felt indifferent to mild symptoms, does this change your perspective? And it gets more concerning. A whopping 78% of high-risk individuals in Singapore either don't believe they're at risk or are unsure. High-risk groups include the elderly, pregnant women, and those with chronic conditions. Could this underestimation lead to more severe outbreaks? Let us know what you think. COVID-19 isn't just a risk to individuals, it's a challenge for public health. Reduced testing and delayed treatment could burden healthcare systems. So, as we move into 2024, let's ask ourselves, are we doing enough to stay prepared? What are your thoughts on Singapore's reduced testing and vaccination rates? Do you agree with the experts, or do you have a different take? Comment below. And while you're here, don't forget to like, share, and subscribe to 2230 for more in-depth updates and discussions. Let's keep the conversation going.